Uh, so my name is Igor Granov. I'm the COO of NI Medical. NI Medical is an Israeli company that have developed the NICAS. NICAS is a non-invasive hemodynamic monitoring device that provides a solution for management of various patients, populations such as heart failure patient, hypertension, and in addition to CRT optimization and some other clinical disciplines. So I think the main issue for the patient is, the quality of life. And up till now, heart failure patients have been suffering from very high percentage of readmissions and hospital admissions, and obviously nobody really wants to go back to the hospital or go to hospital at all. And NICAS provides information that can prevent hospital admission by giving ICU level information to primary care settings, allowing the treating physician to provide direct treatment to the cause of the decompensation, thus basically removing heart failure burden, both economical and personal. So average physician in the community doesn't really have any information about patients' hemodynamics, other than blood pressure. And with all due respect, and I believe that blood pressure is a major vital sign, but I think cardiac output, stroke volume, peripheral resistance, and cardiac power, which are basically are as vital as blood pressure in management of the patient. And the only reason why this was not standard today, or why it's not the standard today, is that the fact that it was impossible to do that outside of an OR in an accurate way. So basically what NICAS does, it's by placing two sensors on patient limbs, it allows you to see all the patient's hemodynamic data, preload, afterload, contractility. And once you know what you're doing, it's so easy to treat it. So it's actually an excellent question, because one of the trials that we have submitted to the ACC, hopefully this is going to be accepted and published, is about management of hypertension in the community. And it's over 5,700 patients, and good portion of this patient are from African American, we call it less privileged communities in Columbus, Cincinnati, and Dayton area. Very unprivileged, people that don't have enough funds to buy medications, and we're able to reach levels of control of hypertension that are significantly higher than levels of control that, national average is 44%, we're over 90. And additional part with the heart failure management, what NICAS information allows is that you don't really need a physician at spot. The information that we provide actually allows a physician in a remote location to have enough information to be able to prescribe medications without actually seeing the patient in front of you. Definitely, because it basically allows you to delegate the part of the testing and rely more on the information rather than sending patients. It also reduces the burden on the physicians, because they don't, on average, if you go to cardiologists, he would spend good 30 to 40 minutes with you trying to estimate and understand what's the causes, what's the reasons. You need to go to various tests before that. You need to do an ECG test, a 12-lead ECG, preferably to do an echocardiography test. What NICAS provides you is a highly reproducible hemodynamic information and gives you a clear view into the person's heart.